Three healthy habits for HSAs, according to Fidelity. I don't think I've done any episodes, videos on HSAs, health savings accounts. So I thought it'd be interesting to do this and also to test my new mic, not my new mic, but the audio, because I was having some issues before. I had too many windows open, so now we have three. So let's see if this stays true to form. So it'll be killing two birds with one stone. Test out my mic, my audio, and then also seeing or talk about HSAs as well. So 4 S's, all right? Do the 4 S's. What's the 4 S's, Josh? Remind us. Subscribe, share, smash, and say. And of course, just say means comment down below. All right. So let's see what we got here from Fidelity from October 15th, 2018. 3 easy ways to make the most out of your health savings account. Now, I got to tell you something, my friends. My dad, I don't have a relationship with my dad, but my dad was a big integral part of HSAs and the predecessor medical savings account, MSAs. He used to work for the NCPA, the National Center for Policy Analysis, with a guy named John Goodman, who had written the book, probably a seminal book on just getting the power back into the doctors and the patient's hands. We call it people. I think it's people power, patient power. It wasn't people power. I think it was patient power. I forgot what it was. But talk to us simply about the freedom, bringing freedom to medical area in terms of your health insurance and health care. Because remember, you can have all the health insurance you want, but if you don't have care, it doesn't mean anything. And I think it was patient power, I'm sure is what it was called. It was back in 1995, 1996. NCPA, unfortunately, I don't say collapsed. They disbanded a few years back, which is too bad. It was a wonderful, wonderful research think tank. But like all think tanks, not getting money from the government, it's going to be hard to keep yourself existing just because there's only so much private money out there. And sometimes the private money wants you to push a certain agenda. And the government wants you to push a certain agenda as well. So if you are willing to push that government agenda, you'll have money. Climate change. If you're not willing to push that agenda, you're not going to have any money unless there's a good donor. So NCPA disbanded, which is too bad. But anyway, so back in the day, we had MSAs. This is the Kennedy-Kassebaum bill around that time in 1995. Nancy Kassebaum was a Republican senator from Kansas. Ted Kennedy was Ted Kennedy, Democrat from Massachusetts. They came to be, and that's where the COBRA thing came in. But also a lot of the HIPAA stuff, some of the insanity of HIPAA. And I to be honest, it's been so I can't remember the exact premise of this. My dad used to do this health benefits newsletter. I can't remember what it was. I used to curry it from his home. I think I was living there. Curry it from his home in Alexandria to DC, the Russell office building, the other Senate office buildings. I think I went into the House places, but I used to curry it back and forth to give to the policy analysts for the various senators and whatnot. It was fun. It was a good time. Going to D.C. Is let's just put it this way. If you're a young man, you go to D.C., you'll be in a good place because there's a lot of, I hate to say misogynist, but let's just put it this way. There's a certain type of lady who gets jobs working for these senators. And it's just, it is wrong, man. There's no other way around it. This is why all these politicians hold themselves out as holier than thou. Look, it's on both sides. Everyone went after Bob Packwood back in the day in '92. We heard about the Ted Kennedy, Chris Dodd sandwich. It's just these guys are freaking scumbags, man. There's no other way around that. Are they still like that? Probably not as much, but I guarantee there's some skeletons in the closet which are shameful. No other way around it. And as the dad of 2 daughters, I find it shameful. And you know what's going on there is that it's just sad. I find it disheartening, disenchanting. And so when I had my fill of DC and the hypocrisy, we're all for women, and I saw what they were doing there, and you saw what's going on. It's just it's disgusting. Really, it's disgusting behavior. So if you're in Akron, Ohio, for instance, and thinking your senator is holier than thou, and that they're looking out for you and your sisters or daughters, some of that, they're not, man. They're not. Absolutely not. They are looking out for themselves, number one, without question, and will forever be. I don't know. Now that we have more women senators, will it be the same? Sure. I mean, you look at Amy Klobuchar, whatever her name is up there in Minnesota, and just a freaking Nazi to her staff. It's just sad. Why am I rampant on this? Because I see it with my own very eyes, the progression of choice in health care and how it's just under Hillary Care, what she was trying to get passed. And my dad was just hugely advocate on the health saving bacon freedom, patient freedom. He used to say, why should he who smokes, who doesn't, who I don't think he drank back then, who smokes, who doesn't get an exercise, why should he pay the same premiums as me? I just got out of the infantry. I was 22 years old. I was working out. I didn't smoke. I was drinking, but still, he's like, that doesn't make any sense. Why should we have the same premium, which is what Hillary Care was trying to encompass. And the same thing as Obamacare, not quite, but still a lot of similarities. Like you're saying, okay, we're going to punish the healthy to take care of the sick. And that's just, you can't do that if you want the healthy to play a part in that. And to Obama's credit, he said, we can't do that. So we're going to give you a penalty if you don't buy it. I mean, that's exactly, he said, we're going to basically whack you if you don't do what we want, which is freaking scary from the federal government perspective to say you and your individual choices of the consumption of the products that you want. If you don't do what the government says, we are going to fine you. And inherently, you go to jail. You don't pay the fine, what happens? And people say, well, you have to buy auto insurance. No, you don't have to drive a car. You don't have to drive a car. And then on top of that, how many people actually don't have auto insurance anyway? All right. We know for a fact a lot don't. How? Because my wife got hit by somebody a long time ago in Phoenix, Arizona, and didn't have auto insurance, who wasn't supposed to be here to begin with. And so I just don't want to hear all that stuff. Like, oh, you have to have this. No, that's by the state anyway. The state has, so you can still advocate for your state. This is from the federal government telling you have to buy a product. It's scary, man. And I know Medicare is like that. I get it. Medicare, you have to get Medicare at 65. If you don't, you have this huge penalties. I get that. Look, I get it. I don't like it. I'll play by the rules. I still don't like it. The government should not be forcing you to purchase products. That's all there is to it. Why do you think the insurance companies were so in favor of ACA, the Affordable Care Act? And why do you think the physicians, whatever they're called, the doctors group there, I forgot what they're called, because they know there's a guaranteed steady stream of customers and clients. They know this. Anyway, so let's go on. So anyway, we had MSAs, which were the predecessor, and I forgot the guy's a congressman from Texas. I'm drawing a blank what his name was. I can't believe I can't remember his name. Anyway, there's a congressman from Texas, Archer. Bill Archer was an Archer Medical Savings Accounts, and now the HSAs have taken over, which I love. So, all right, enough the ramble. Sorry about that. Let's go into this. I know people say, you talk too much. Hey, look, then freaking move on. I don't care. I mean, there's a history that I think is important to understand how this works and what the government that you are allowing to essentially control your life, the hypocrisy that is in there at all times. And, obviously that doesn't mean you don't pay your taxes. You don't rebel. Knowledge is a wonderful thing to have. And once you see for your very eyes, like these guys are fake. It's fakery. It's all smoke and mirrors. Then you start saying, if that's smoke and mirrors, what else is smoke and mirrors? And it just, red pill, scary, but when you get it, you'll never go back. All right, so 3 easy ways to make the most out of your HSA now into your retirement. So Fidelity says, key takeaways. HSAs offer a number of benefits, not only spending for the short term, but also saving for the longer term qualified medical expenses, including those in retirement, which is flipping awesome. Unlike flexible spending accounts, FSAs, flexible spending accounts, which are use it or lose it. You have to use it by the year end or else it's gone. HSAs, you don't forfeit any amount that's in there and it can still grow for you. Once you reach the age of 65, you can use your HSA to pay for COBRA and or certain Medicare premiums as well as long-term care insurance. Interesting, huh? More and more employers are offering HSA-eligible health plans to their employees. These plans are also known as high-deductible health plans. So you have high-deductible health plans and you're pairing it with an HSA. I want to make that clear. You don't just have an HSA and have coverage. That's not the coverage part. The HSA is a funding mechanism of your high-deductible health plan. If your company offers this option and you are not taking advantage of it, you may be missing an opportunity. In the past, you may have heard that HSAs are a convenient way to pay for out-of-pocket expenses such as doctor visits or prescriptions at the local pharmacy. But did you know that HSAs can be used in a variety of ways to help manage other qualified expenses? The basics. HSAs are individual accounts that work in conjunction with an eligible health plan, high-deductible health plan, to allow employees to cover qualified medical expenses. If you put money into an account, an HSA, and use that money to pay for a doctor visit or another qualified expense, you'll never pay federal taxes on that money. State taxation may vary, but most states follow the feds. What's more, unlike flexible savings accounts or flexible spending accounts, HSAs are not subject to use or lose, which we just talked about. Funds remain in your account from year to year, and any unused funds may be used to pay for future qualified medical expenses. So what are the advantage of HSAs? Most employers offer company contribution. I'm telling you, that's big. A convenient vehicle to save for out-of-pocket costs with an HSA eligible plan. Triple tax advantage. This is huge. Contributions, earnings, and withdrawals are tax-free. Contributions, earnings, and withdrawals. Did you hear the first part of that? Contributions are tax-free. Are contributions to a Roth tax-free? Negative, or as we say in German, niet. No, that's Russian, right? Niet. Opportunity to save for future qualified medical expenses, including in retirement. Part B premiums. Interesting. The IRS max contribution for HSA in 2019 is $3,500 for individuals selecting a single coverage under a HSA, a high deductible health plan. $7,000 for a family electing the coverage. Individuals ages 55 and older can add another $1,000. You can use an HSA to pay for some or all of your qualified medical expense each year and let the rest of the money grow, potentially tax-free. And if you have the cash to pay for your medical costs out of pocket, you can let your entire HSA grow tax-free for future qualified medical expenses. All right, so HSAs are 3 healthy habits. They cover anticipated out-of-pocket medical expenses. Each year during annual enrollment, you have the opportunity to make healthcare choices that serve the needs of your family. You may be wary of enrolling in the high deductible health plan because you are concerned about potential out-of-pocket costs. You may worry, what happens if I get really sick or have a catastrophic event? Where will I get the money to pay for the deductible? Well, you should start factoring your deductible and any out-of-pocket costs, but you may not realize is that you may be paying more than $2,000 every year in premiums for a lower deductible plan, such as a preferred provider organization, PPO, whether you need services or not. Generally, those who elect an HSA plan pay a lower monthly premium for health coverage because they're going to have a higher deductible. And if you actually use that deductible, you can pull it from your HSA tax-free. So it's a wonderful thing. It's freedom, man. It's wonderful. What's more, most preventative care and screenings are typically covered 100% by insurance, including HSA high deductible health plans. So again, you say, how am I going to pay the deductible? Well, HSAs have a lower monthly premium because they have a higher deductible. And inherently makes sense. Higher deductible, lower monthly premium, lower deductible, higher monthly premium. So you're saying, let's say your company gives you $5,000 and they say, we're going to put $5,000 in your HSA. All right. So now you put $5,000, they put, I'm just using that for example. You put 5,000, they put 5,000. You put 2,500, they put whatever it is. And you got, we'll just say $5,000 is sitting in your HSA. All right. Now your deductible is $6,000 because you have a low monthly cost on your high deductible health plan. Your premiums are low because you have a high deductible. The amount you save from your deductible plus the $5,000 your company contributed or the $2,500, however it shook out. Now you got a catastrophic issue where you got to use the deductible, which is high. Well, you just go to your HSA. Some of the savings you made from a lower monthly expense because your premiums are that much lower. It's a wonderful thing. And if you don't use it, guess what? It just grows tax-free. Tip, consider how much cash on hand you may need to cover anticipated or unanticipated medical costs. If you're not sure how much to set aside, you may want to start keeping your plans in-network deductible cash and then make changes over time. It's always easier said than done. While you cannot be enrolled in a general purpose flexible spending account, if you elect an HSA plan, more employers are offering the option to enroll in an HSA eligible FSA, meaning you can set up aside $2,650 pre-tax and an limited purpose FSA to pay for current year dental and vision expenses. However, your employer sets the maximum level allowed, which could be less than the $2,650 noted here. It's confusing. I get it. Frankly, I never liked the FSA. I never thought it was. I mean, it's tax deductible. Yeah. Well, how many people are actually taking the tax deduction? Well, you pay for it. It's not a deduction on your 1040. It comes out of your tax. There could be some benefit there. I would still go with HSA because of no use it or lose it provision. No use it or lose it provision means you can allow that puppy to grow tax-free. Did I say tax-free? Yes, I did. And it goes in tax-free as well. Take advantage of available employer contributions. If your company supports your efforts to save with an employer contribution, you're in good company. 21% of all HSA dollars contributed came from employer in 2017. So that's fantastic. The average employer contribution was $600. Man, that's not taxable, man. That's real money, free. Combined with your own contributions, the contributions from your employer go a long way to meeting anticipated qualified costs. While employers may have different rules and timing for the contributions, a common approach is for employers to deposit their full annual contribution at the beginning of the year. Exactly. That's what USA used to do, which is awesome. Save and invest for future qualified. This I love, for future qualified expenses. Most financial professionals suggest that individuals can benefit from tax-advantaged vehicles such as workplace savings and HSAs. Generally, an HSA health plan with an HSA enables you to set aside pre-tax dollars through payroll deductions. Let's see. For example, let's say an HSA can remain in your from year to year, and you can take it with you if you switch employees or retire. And it can be because it can be invested, i.e., in mutual funds, stocks, ETFs, anything like that, and you don't tap into it because you're going to take care of your deductibles and your copays with cash. That sucker can grow and grow and grow. Let's say let's say a family coverage and HSA plan, you save $3,000 for future use and you plan to spend $2,000 on the eligible cost. Without dipping into your HSA, if you want to consider a strategy that can provide additional tax advantages, increase your pre-tax HSA up to $5,000. Then spend $2,000 tax-free directly from your HSA on your out-of-pocket expenses. And I would add, you should invest that money as well. Oh, and there's our study from Fidelity. 65-year-old couple retiring in 2018 is estimated to need $280,000 to cover medical expenses through retirement. Yes, but HSAs can help cover some of that. Consider contributing the maximum allowed available to the HSA. Okay. You should also consider investing the portion that you're saving for the future in an asset mix, i.e. invest in the long term for growth. I mean, if you can get that $5,000 to grow, if you get 10% a year, that's worth $10,000 in 7 years. That's the way to go. 4 ways to use your HSA in retirement: help bridge to Medicare. If you retired prior to 65, you may still need health coverage. Help bridge the Medicare gap to age 65. Generally, HSAs cannot be used to pay private health insurance premiums, but there are 2 exceptions. Look at that. COBRA. Paying for health coverage under COBRA is an exception in paying premiums while receiving unemployment contributions. This is true at any age, but helpful if you lose your job. So if you have an HSA and you're going on COBRA and you don't want to pay COBRA like what I had to do with taxable money, where I got not only income tax on, but I had to pay a penalty, your HSA is a wonderful mechanism to pay for COBRA. This, I'm telling you right now, it's a big deal. Medicare premiums. You can use your HSA to pay for your Part B and Part D premiums, but not supplemental policies. They don't say anything about Medicare Advantage. It says supplemental. They say Medigap, but I don't see Part C. So I'm not sure if you can use your HSA for Part C. I don't know. I'm going to presume not, but you can use it for Part B, and Part D. So if you're 45 years old now, if you got 20 years, you're dumping $5,000 in there, your Part B and Part D is freaking covered, tax-free on both ends, tax-free going in, tax-free going out. You don't have to worry about it again. Long-term care expenses. You can use Part to cover the tax-qualified long-term care policy. You can do this at any age, but the amount you get qualified tax-free is more the older you get. There's no penalty if you use your HSA for anything other than healthcare after the age of 65. So that's good, but you will have to pay income tax similar to pre-tax withdrawals from your IRA. All right. So there's a lot of good stuff there. I'm a big fan of HSAs for sure. It's confusing as all can be. I get it. But, man, they're definitely something to look at, especially if your employer is contributing to it. I just look at it like this. I got 2 things I really want to focus on, Part B and Part D. That's $180 a month essentially right now. We're going to assume it does not allow you to pay for Medicare Advantage. It said explicitly not Medigap. So we'll just say it's not going to be your supplemental or Part C. Either way, Part B and Part D for you and your spouse, that's about $350 together right now. So I'm going to start saving for an HSA, and I'm not going to touch that for only 2 reasons. One is I quit my job and I go on COBRA, and I can use my HSA tax-free to cover the Cobra premiums for, I think it's 18 months. And number two, I use it for Part B and Part D. It's a wonderful option, man. Take advantage of it. Invest it aggressively if you don't think you're going to be using it for a few years, and you should be. That should be a pretty good deal for you, especially if your company is putting in a couple $1,000 as well. All right, as always, 4 S's: subscribe, share, say, and then what's the last one? Smash. Okay, we'll see you next time. Thanks.